Great. Welcome to Let's Talk Mental Health with Dr. Selim. This week's session is going to be on sleep. I am Dr. Ashique Selim. I'm a consultant psychiatrist and the managing director of the Psychological Health and Wellness Clinic, also known as PHWC. So, PHWC is a multidisciplinary mental health treatment facility in Bonani, which is in Dhaka, in Bangladesh. We have been open for 2 years now, and we have a team of 18 professionals, including psychotherapists and psychiatrists. We try and see people from a range of difficulties. And such as if people want to engage with some self-improvement, or if people are having serious mental illness such as schizophrenia or bipolar disorder. So our multinational team of therapists and doctors are able to provide a comprehensive assessment and a treatment according to which is tailor-made for that individual. We also provide corporate well-being to organizations, and you should be able to find information on our website or on our Facebook page. Our center is closed at the moment, but we are available for online consultation. So please send us a message on Facebook, or you can give us a call on our reception number, which is 0177 777 2764. So that's 572764. Or you can visit our website, which is www.phwcbd.org. So this is now my second video. The first one was on anxiety. It was a bit rough, I must say, but a great learning experience. And thank you for all the wonderful feedback I got, because now I have the courage to now do a second video today, which is on sleep. Please, if you are interested, you can watch the previous video, which is still on Facebook, and follow PHWC as a page, and also if you can like our page, then you can get other information, more videos as and when they come. Right. So last week's session was on anxiety. I want to do a quick recap before I move on to today's topic, which is sleep. So last week we spoke about anxiety. So anxiety is a very normal experience. Everybody has it. Some people have what we call an anxiety disorder, but the majority of people, they don't. It's not a disorder. It's a very normal emotion that we feel in response to fear. So how does it present? Anxiety presents usually as shortness of breath, an increase in heart rate, a butterfly feeling in the stomach, sweating, something that everybody feels when they're on their way to an examination or just before a interview. So that is anxiety or stress. Unfortunately, for some, it becomes problematic. It becomes chronic when they feel this anxiety, this fear, at times when there is no perceived threat. There is no risk of not getting the job or being turned down. It's not that. So some people experience this anxiety at normal times. So it can be quite disabling. It stops people from socializing, stops people from working, and quality of life can decrease. Identify it when you notice that you're starting to make social changes to your pattern when because of the fear of anxiety. What to do? The easiest thing to do for anxiety is to breathe, to learn how to breathe. It sounds very silly when I say that we should learn how to breathe, where breathing is such a normal thing. But there are lots of videos on breathing. I did a very quick breathing exercise on my last video, but I hope to put another one up in due course, which will be more comprehensive. Sharing your thoughts and feelings with loved ones is always helpful. It definitely helps to deal with anxiety. Exercising, light exercise on a regular basis is very helpful. And during this time of the COVID crisis, connecting with people, talking with people is very important. Limiting our access to the doom and gloom news is very important. There's all sorts of all sorts of um, information out there from different sources, which we find quite troubling, and it increases our anxiety. So, limiting social media to a few times a day is very important. So I hope today's session will be interactive. Last week we had lots and lots of questions, which made the session go on for a full hour. Um, if we have questions, it doesn't have to be about sleep. Questions can be about anything. So if there's a question coming in about where the previous video for anxiety is, if you can't find it, I will find the link and send it to you. Um, so we'll do that at the end of the video. Um, so so as I was saying, if we can ask some questions, then the session will go on. Otherwise, it'll get a bit boring for me as well. Right. So let's dive into today's discussion, which is going to be about sleep. Now, sleep is like breathing, actually, because last week we talked about breathing. And like breathing, sleep is something that we take for granted. We think of it as one of those basic bodily functions that we experience, and we don't really give it a priority. Um, there's a very good book which I read recently, and it was actually referred to me by a previous client, and it really changed the way I think about sleep. The book is called "Why We Sleep" by Matthew Walker, and it is probably the most comprehensive uh, narrative on sleep right now. It's very approachable, very easy to read, and very helpful. Very helpful for those, especially those who may be struggling with sleep at the moment. Um, so, as I was saying, sleep is something that we take for granted, and we ignore at our own peril. The difficulty is that it's not only that we ignore it. In our busy life, in the pre-COVID life, when were living the rat race, people actually often think of sleep as an obstacle. It's something that needs to be done. That we that it's taking away our productivity. And throughout the years, there have been many campaigns which have actually actively targeted sleep to to make people feel that we don't need a full 8 hours of sleep. And we've heard of certain world leaders who survived on 4 hours or 6 hours of sleep, and they did very well. But the truth, the research that has been happening over the last few decades tells us otherwise. We now know that actually all human beings, irrespective of ethnicity, require 8 hours of sleep a night. Now, some people, there are a very small proportion of people who can survive on 7 or 7.5 hours, but the majority of people, the vast majority, 99% and above, actually require 8 hours of sleep a night in order to have a healthy, wholesome lifestyle. I know as I say this, people will be laughing and they say, well, we work in a bank and that's not possible. I only spend 8 hours at home. How can I possibly sleep for 8 hours? And I guess there are exceptions, especially when people have young children, that we don't get 8 hours of continuous sleep. But that doesn't mean we shouldn't try, because now the evidence is stacked up for us to say that why we need these 8 hours of sleep. Um, I won't go into the social context. There's a lot of evidence, a lot of studies which say that maybe earlier hunter-gatherer men, human beings, didn't sleep as long as 8 hours, and they were fine. The reality is that health problems were always the health problems are there. They were the same then, and they are the same now. Um, and we'll come to those in a bit. So we know the benefits of sleep, but what are the harmful effects of not getting the sleep? I'm just going to pause for a minute and see if there are any questions at this stage. Um, and there are a few comments, but no questions yet. But please ask them questions so that we can pause my monologue, and then we can engage in some questions. Once again, the questions don't have to be about sleep; they can be about anything related to mental health, and I'll try my best to answer them. Before I dive into more details about sleep, I'm going to just mention that the context. So, why are we talking about sleep today? So, we're all finding ourselves in this difficult situation, this crisis, this COVID crisis that we're in right now. It's an unprecedented event which has affected almost everybody on the planet. And I was reading an article which said that almost half of humanity are confined to their houses. Now, this poses some unique problems. So I was talking to a friend who said that he's now sleeping till midday every day, and but he's up all night watching YouTube videos or watching Netflix. Now, um, give me a second. Right. All right. So I'm just reading a few questions. Sorry about the pause, but we'll try and make this more seamless. So what's happening is that we're finding ourselves at home all the time, and there is a propensity to having to sleep, to sort of, for example, to sleep more, to sleep later, and to wake up later. And as a result, what's happening is that we actually may end up sleeping more than the 8 hours, which is recommended. Now, more than 8 to 9 hours is also not good because it increases lethargy. So, maintaining the routine in sleep is what we're trying to is what we're trying to get. I have seen a few questions, so I'm just going to go onto those questions before I move on. So there's one question here which says, "My mother doesn't sleep 8 hours, so she does so much anxiety." Now, there is very clear evidence which links a reduced amount of sleep with an increased amount of anxiety. If we don't sleep 8 hours, we don't feel, our levels of anxiety during the day do go up. Sleep is very, very closely linked to mental health, and I will spend a little bit more time talking about that a little bit later. But just to answer your question, yes, it is possible. Right now, I'll just introduce one concept, and this concept is that of available sleep time. Now, we very often think that, okay, we go to bed and we toss and turn for an hour, we fall asleep, and then we wake up 5 hours later, so we had 5 hours of sleep. But the concept I want to introduce today is that of available sleep time, which means that, say, about 10 o'clock in the evening, I turn my phone off, I turn off all devices, I go have a shower, I get ready for bed, and then I'm in bed, say 11 o'clock. Now, at that time, I turn the lights off, and so my available sleep time starts at 11 o'clock. Then I'd stay activity free from 11 o'clock till 7 o'clock in the morning. Now, chances are that I may not have slept that whole time, but that whole time is what I have given myself available sleep time. Now, if I say I make that 8 o'clock, so that means I've given myself 9 hours of available sleep time. Now, chances are, if I have followed uh, the things I was supposed to do or the things that encourage healthy sleep during those 16 hours of wake time. So the 8 hours of sleep leaves us 16 hours of wake time. Now, if we do what's right for us under normal circumstances, during those 16 hours, we should have a good amount of sleep during those available sleep time. But what's really important is that we give ourselves that time. So that's one question, which is anxiety. Again, the same person said that my mother worries too much. So that's kind of related to um, to anxiety. And in my previous post, I talked about anxiety in more detail. But if it's very problematic, then please get in touch with the clinic, and someone can have a chat with her. There was one question about does the sleep need to happen at night? Now, there is benefit of sleeping during the nighttime. Um, Evolutionary wise, we have what we call owls and larks. So owls are people who prefer to stay awake at night, and they do wake up a little bit later. And we have larks, are the people who wake up early in the morning, and they do go to sleep earlier. So um, this has an evolutionary advantage. So before, when we used to be hunter gatherers, there was the issue of the night's watch. There was a certain group of people who did prefer to stay up at night and sleep in the day. Having said that, if we do not get any sunlight at all, that is very unhealthy, because making sure we get sleep is actually one of the. So there are three different chemical pathways which regulate our sleep, and one of them is melatonin, which is very closely related to exposure to light. So exposure to daylight. If we get exposure to daylight throughout the day, and then after sunset that exposure is limited, then it encourages a normal sleep cycle. There's another another rhythm, which is not related to this, and but that's a different pathway altogether. So three different rhythms are going on in our body at any time, which will have they all three need to align to make sure we have a good amount of sleep. So one is the light, one is a natural rhythm that happens, and then there's a circadian rhythm. So there's three different pathways. There's again, a friend of mine mentioned that with a newborn, 8 hours of continuous sleep is not possible. Does too much caffeine lead to the problems later? So, two issues you've mentioned here. One is, yes, if you've got children, and what can you do? The child needs feeding, child needs changing. But once the child is old enough, that we need to try to make sure we get back into that pattern. The second issue is caffeine, and I'm going to talk about this a little bit later, but I'll mention it now. That caffeine is one of the worst things that we can do for our sleep. So caffeine actually blocks a particular chemical in the brain that we need. Remember, I was talking about the three different cycles. So one of the chemical cycles, caffeine actually blocks that cycle. So what happens is that we have this normal rhythm anyway. So if we have no caffeine and we wake up at normal times, we wake up in the morning, we feel fresh. As the day goes on, this particular chemical, it accumulates and makes us to start feel a little bit lethargic. So when we have our midday coffee, then we block that chemical again and we feel a little bit alert. But then what happens is about 3 or 4 o'clock in the evening, again, we start to feel a little bit drowsy. So then we have another coffee then, and that chemical again gets blocked. Now, this chemical doesn't go away. All that happens is that it gets accumulated. So what then happens is that when it gets to nighttime, the whole balance, the whole rhythm is then disrupted, and it then affects our sleep throughout the night. So caffeine is something that we need to avoid, if possible, completely. If not completely, then in the morning, that's fine, but definitely not past 4 o'clock, and definitely not more than two to three portions in a day. So not more than 2 to 3 cups of tea, or maybe two or three single shots of coffee in a day, and not after 4 o'clock. So that's with the caffeine, but we'll talk more about that later. Um, I'm being beckoned. Did you say something? No. All right. Okay. All right. Uh, okay. Right. So, what to do when I can't sleep 8 hours? After every 2 hours, I wake up and can't sleep. Last 7 days with me. So that's it's very common. That does happen. Now, when we are sleeping, we have our normal sleep cycle. So, which means that um, we have the stages of sleep. So we have four stages of sleep: one, two, three, and then REM sleep, which follow roughly about a 3 hour cycle. Now, it is normal for us to wake up after a full cycle of sleep, and and we find ourselves, we wake up, and then we toss, we fix the blanket, we have a sip of water, we go to the toilet. So it's very normal to wake up every 3 hours, but usually we're not awake for too long. Maybe a minute, less than a minute, and then we fall back asleep. So um, so it's normal to wake up. Now, if you find that you wake up and you're completely awake, that means that there's a problem somewhere, that there's a disconnect somewhere in the routine. So that means that during those 16 hours of waking, there's a problem happening. Because if there is a problem happening, then it'll affect those 8 hours. So we need to think, when we think about sleep, we actually have to think about it a little bit different. And we need to think, well, what's happening during those 16 hours? So am I stressed? Am I worried? Am I eating too much? Am I exercising too much? Am I exercising too little? So there are certain factors which are affect our sleep. Are we having too much coffee? Are we having too many intoxicants? So for example, some people will have a drink, or some people smoke cannabis in the evening. Now, if you have it too close to sleep time, then it affects your sleep throughout the night, and you will wake up intermittently, and you'll have different issues. So there are many factors which influence a full night's sleep. I'm just going to go back to some questions because I can see there's a few. Um, so this one's about eating, how to disassociate eating as an activity. And I think what I might do is, actually, I won't talk about that today, but I'll write you a message in the comments once we finish today, because but it's very true. Eating is an interesting one. Um, so again, an issue about heart patients. Now, there's very clear evidence that in order to maintain good heart cardiac health, we need to maintain a good sleep cycle. So if we have less than 8 hours sleep, and they've done research studies where they've sleep deprived people of only half an hour to an hour of sleep from their normal 8 hour routine, and they found that within a few days they developed hypertension. So they find that within a few days, people develop their blood sugar goes up. So and this is normal, healthy people. So if any of us just sleep deprive ourselves for a few days, check our blood pressure, it will be higher. So for patients with cardiac problems, maintaining the 8 hours of sleep is absolutely crucial, and it has to be given priority. Now, the reason why so many of us don't get it is because we don't prioritize it. We don't think. We go to the doctor, and the doctor says, make sure you exercise for half an hour, make sure you eat healthy, but they never say make sure you sleep 8 hours, right? In fact, many health professionals, many doctors will prescribe sleeping medication, which is actually the worst thing that you can do for your sleep, is to take medication. But once again, that's a whole topic, and I'm going to spend about a little bit. Uh, I'll talk about it a little bit later. Um, there's one comment about anxiety is very difficult. Now, the thing is that anxiety, if someone is experiencing anxiety, there is no reason to suffer from this. There is help available, there is therapy available, and there is medication available. So please, if sharing with friends and family and self-help isn't enough, then please get in touch with professionals. There are many professionals and many centers in Bangladesh which can provide this help for anxiety. So please get in touch. Please feel free to contact our center You can send us a message on Facebook and we'll call you back. Or if you call us on our reception number, which is 0177 So that's 0157 2764, then you'll get all the information you want. Right, so great question from a dear friend. Is there a relative advantage in terms of mental and emotional health in being either a lark or an owl? And the answer to that is that I don't think so. That not that I know of. Both are equally as important for society. So from the hunter-gatherer days, both were important. You had to have the people who woke in the morning and did the chores, and you needed the people who were up at night to keep the tribe safe. And now it's very much the same. That we need, we need both people. But whether there's an emotional advantage, I don't know. But what's important is that even though the timing of the sleep is different, we need to make sure we try and get those 8 hours of continuous sleep. Yeah. So, new question. Because of this home quarantine, many of us change our sleep pattern and timing, like sleeping in the daytime. Does that affect your health mentally and physically? So, that's a great question. Now, there is some suggestions that we do follow a sleep cycle where we have the majority of sleep at night and a nap in the day. Now, if some people find, and in many cultures, this is a very common thing, and they find that a nap in the day is helpful. Now, what we mustn't, what we have to be very careful of is that if we do take a half an hour nap in the day, so under no circumstances must it be more than an hour, but this hour should not be added to those 8 hours of night sleep. So the 8 hours of continuous sleep is completely different from a nap during the daytime. So you are right that now, because of this COVID crisis, we're at home, we're working from home, we have our rice and dal and fish, and then in the afternoon we take a little nap. It's not unhealthy, but there's a misconception that if we do take this nap, we then need less sleep at night. Now, that is a complete misconception. And again, there's a lot of research which tells us that that is not the case. It's two separate things. So if we do sleep, that's fine. Even then, we need to make sure that we get to sleep at time and we wake up at time. We need to give ourselves those 8 hours of available sleep time. Right. Um, So, thank you for all these questions. It's making the session flow a lot better, and it's also covering almost all the topics I want to talk about. So, there's this question now which says sleep cycle is totally reversed, can't get it back to normal, and this is it's a very common problem, especially those who travel a lot. Now, obviously, that's not a concern because people aren't traveling anyway. But but what happens is that, yes, I spend one night playing video games all night. I'm up till 6 in the morning, go to sleep, and then again up at 12. So you get 5 6 hours of sleep. But the key here is what I said earlier, is that in order to get 8 hours of sleep, we need to make sure we have the 16 hours of wake time. So again, the wake time is what is very, very important. Now, if your cycle is reversed, that means you're waking up at, say, 4 in the evening. Now, if you wake up at 4 o'clock, you're not going to be able to sleep or you won't feel sleepy, other than the normal two dips which I talked about. You won't feel sleepy 16 hours after that, right? So that's four, and 4 plus 6. So that's, you're talking about 7, 8, 9, 10 o'clock in the morning the following day. So you're not going to. So that's not going to help. We can change it, but we can only change it gradually. So you can't change your sleep cycle more than 2 hours every 3 or 4 days. Yes, you can push it, but that doesn't help. It won't do that. I'm going to use this opportunity, what you said right now, to introduce another misconception, and that is of sleep debt. Now, we very often we have this misconception that I can work all week extra and then not sleep, and then on the weekend I'm going to sleep extra and make up for it. Now, there is no evidence which suggests that we carry over a sleep debt, that I haven't slept, I've sleep deprived for a week, and on the weekend, if I sleep an extra 10 hours, it's going to help. There is no evidence that says that that is healthy for us. What we do know is that any amount of sleep deprivation is bad for the health. And not just bad, it's permanently and quite severely bad. Relevant to the COVID crisis, right now, um, so one of the biggest effects that a reduced amount of sleep has is the effect on the immune system. Now, as it is, we're washing our hands all the time. We're trying to stay safe. We're avoiding getting infections, avoiding getting bugs. But on the other hand, if we're not sleeping, then we're making ourselves prone to getting infections. So while we're trying to avoid it, if we don't sleep, we are going to get it. There's been research in which a person was given a vaccine after having 8 hours sleep, and another group was sleep deprived by an hour and given a vaccine the next day. The efficacy of the vaccine was much lower in the people who were sleep deprived, and this is all established research. So the reduction in the immune system, and this is actually something that we'll see. A lot of people see it, that if they're working too hard, they're not sleeping, তখন কি হয় সর্দি পড়ে যায়, or ঠান্ডা লেগে যায়, or they catch a cold, they fall sick. So, so just coming back to that, so the misconception of the sleep debt, it doesn't exist. And if you need to try and change your cycle, then try and do it for not more than 2 hours every 2 days. So if you woke up at 4 today, don't push it. Give yourself 16 hours, but then try maybe falling asleep at 14 hours, and then wake up 2 hours earlier. Have to set an alarm. There's a lot of evidence which suggests that if we have an alarm to wake up, it's just as important to have an alarm for when you fall asleep as it is to when you wake up, because that 16-hour wake time is going to dictate those 8 hours. Right. So I'm going to read the next question. People say it's okay to sleep less during the week as long as you can catch up on your sleep in the weekend. Does that really work? If not, what cost does it incur to your body if you maintain a cycle? So, like I said earlier, this is a complete misconception, and it's a thing that is propagated by the production-based society that we live in, is that you can work hard and then you party hard. So what that means is that you work hard all week and then you sleep during the weekend, but this has a permanent effect. We have a permanent effect on our problems. So, for example, like I said, almost all the diseases which are prevalent around the world right now, like hypertension, diabetes, anxiety, stress, reduced immunity, all the problems that we face in our health these days can be exacerbated by sleep deprivation. All right. Okay, well, thanks for that. We'll keep the questions coming. I think I've answered all the ones that have come in so far. Okay. So I'm just going to now move the topic a little bit and talk about sleep, because the sleep I've been talking about now is the sleep of adults. So what we're talking about is people of the adult age. So after puberty. So let's say 20. Now there are some misconceptions about sleep when it comes to children and older people. Now, children need more sleep. There's no doubt about it. And how much sleep they need? Actually, children self-regulate. So if you just leave them to their own devices, they'll get as much sleep as they need to, because they haven't learned to overexert themselves during the day and not sleep at night. They haven't gotten into that overproduction based society that I talked about. But so children will sleep more. However, we do something that is very, very harmful for our children. What we do is we start teaching them to self-deprive. In fact, we force them to sleep deprive. And how do we do that? By sending them to school at 6 in the morning or 7 in the morning. So what we do is we force our children to wake up. There's a lot of evidence that shows that when you have a full night's sleep, the quality of the sleep changes depending on the number of cycles that you have. So if you have 8 hours, then we're talking about, say, 3 or 4 REM cycles. Now, the third or fourth REM cycle are structurally different to the first or second one. So if you make your child sleep, if they sleep late and they wake up early, then they're missing that cycle and they're missing the positive benefits of that last cycle. Now, now this happens, and children they're relatively resilient. They maybe catch up with sleep in the day, but the harmful effect is there. So across many societies, there is now a push to move school time a little bit later, a little bit later, so that children can get that sleep. There's been a lot of research which showed that how that early morning sleep actually improves a child's learning. So they took two groups of people, they woke one group up early, and they let the other one sleep in, and they gave them a task to do, and it showed that the learning of the group that had slept in was significantly better than the group that was sleep deprived. So the research is there. It's just about incorporating it into our routines. When a child gets to adolescence, there's a natural shift in their sleep pattern, a natural shift whereby they want to stay up later and they want to sleep in longer. Right now, this is again evolutionary wise, this is an important thing, because adolescence is a period of transition from a child to an adult. So an adult, the adults, we know that after dark, after sunset, there is the more social interactions between the adults. Used to be pre-COVID, now it's all online, but it's still in the evening time when it happens more. So the adolescent child will want to integrate with the parents during that time. So this is a biological change whereby they want to stay up later and they want to wake up later as well. But what do? We sometimes allow them to stay up late, but we force them to wake up early. Why? Because we send them to school. And this has a significant damaging effect on their learning. If you don't believe me, read the book. It's a great book. So, all right. So I'm going to just go back to a question when I get back my train of thought. So my dear friend, she asks, do some people need less sleep? And like I said before, there is, I think it's less than 0.5% people who need less than 7.5 hours sleep. But 8 hours plus is what more than 99% of human beings do need. So there are very few people who need less sleep. There's a misconception. Some people say, lagana, I can function without it. But we learn to function without it, and we're accepting the health detriment of having less sleep. So we're doing it, but we have to knowingly do it, that we are causing ourselves harm. All right. So with I mentioned adolescence with the sleep pattern. So I just wanted to reiterate that it's important to allow adolescents to sleep late. We sometimes force them to go to bed early, and we say that actually no, go to sleep early. As long as they sleep and wake up early in the morning, it'll be okay. But actually, once they pass a certain age, biologically they cannot sleep early. So we can send them to bed, but they're going to be awake, and then we're waking them early. So then they're facing the health problems of that. Right. Okay. Okay. So I'm going to go back to my list. We've gone through 40 minutes, so it's gone by very fast. Please get the questions coming in. There's one question about food and sleep. So I'm going to now. So we talked about all the things that happen when you don't get enough sleep. So what can we do to make sure we do get good sleep, and how can we ensure that? So the first thing is timing. So we have to give ourselves 8 hours of available sleep time. Right now, when it comes up to sleep time, there has to be a routine, has to be a process. So this process can start maybe 3 or 4 hours before we plan to go to sleep. So if we plan to go to sleep at midnight, we should start thinking about sleep from, say, 8 o'clock or even 6 o'clock. Now, one of the things we can do is we can have indirect lighting. So I talked earlier about the effect of melatonin in the sleep cycle, the circadian rhythm. So the melatonin production is affected by direct light. Now, we are all in effect walking around with artificial suns in our pockets. So we have these lights, these blue LED lights in our pockets, which emulate daylight. So we are seeing this light, and we our brain thinks is daytime. So if we have indirect lights like lampshades, or we use soft light rather than having direct light on us, our brain knows, okay, you know what, it's sunset. So let's start getting that melatonin levels up so that we can fall asleep maybe 4 hours after sunset. So that time, that time is really important. About 4 hours. So about 4 or 5 o'clock, stop having caffeine. So we need to stop having caffeine after about 4 or 5 o'clock, and before that we need to make sure we don't have more than one or two, because even 1 or 2 cups of caffeine a day will negatively affect our sleep. Right. So timing is really important. Um, so it talked about the caffeine. The next is exercise. Now, exercise is really good for sleep. Having said that, exercising too close to sleep time actually also negatively affects sleep. So if you go for a sprint at about 10 o'clock, or a heavy workout, our body takes some time to reset, to recalibrate, and to calm down. And if we try to fall asleep during that time, it doesn't work. We have a misconception that we can make ourselves, we can tire ourselves out, to wear ourselves out in order to sleep, but that doesn't work. It has an opposite effect. So we need to be relaxed. Yes, if you want to go for a small walk, that's okay, get some fresh air, then that's not a problem. uh, the question which says, discuss food that induces sleep. Thank you. So food again has a very important relationship. So we want to avoid having a heavy meal too close to sleep time. It's completely biological that if we've eaten too much, there's a certain level of discomfort. There's our physical processes are busy digesting the food, working through that, and it has a negative effect on our sleep. So we want to have a meal which is, again, not too close to sleep time. So by 8 o'clock, 9 o'clock, if we plan to sleep by midnight, we shouldn't be eating past 9 o'clock. So again, in our culture, people are probably laughing because eat 10:30, 11 is normal. Um, and again, food closer to the mealtime should be, we want to avoid high levels of carbohydrates. We want to avoid high levels of sugar, because sugar and carbohydrates, again, they give us boosts of energy, which will make us feel awake. So we want to focus more on more complex foods, such as fruit and vegetable, proteins of different forms, and maybe less of the simple carbohydrates. So yes, we can have complex carbohydrates such as red flour, but avoiding too many simple carbohydrates, which are white carbohydrates. So that's about food. So um, just recapping the timing of sleep. So if we give ourselves available sleep time, 8 hours of available sleep time, very important. Focusing on the 16 hours. What are we doing in the 16 hours? What are we doing anything that will negatively affect our sleep? I didn't talk about smoking, cigarettes. Cigarettes do have an effect as well. Again, like any substance, we want to avoid taking substances too close to sleep time, because, say for example, if someone is to have a drink, or if someone is to have any kind of other intoxicants, if it happens too close to sleep time, then it will affect the quality of the sleep. Like I said, the cycles. So almost everything we do will affect the quality of that sleep. Medication. Now, medication is a really big one here. A lot of people take medication for various reasons, and a lot of people, in fact, in Bangladesh, I say this often, that there's actually an epidemic of benzodiazepine addiction. Benzodiazepines are all those wonderful drugs that people take for sleep. Sedil and Lexotanil and Dormicum, and the people walk into any pharmacy and get as many as they want. Now, it's now there is no medication that you can take which doesn't affect your sleep negatively. So yes, sometimes people feel a bit more relaxed and they have it, but it will affect the quality of sleep. So when they wake up, they won't get the health benefits of having the 8 hours of sleep. So having any type of sleeping tablet has a profound effect on the quality of sleep, the benefits of the sleep, as well as all the addictive problems that come with being on the medication long term. I was speaking to a senior doctor colleague today who was telling me how the benzodiazepines are being consumed and are being prescribed in the country, and it's a massive problem, right? Because once we start taking these sleeping tablets, we then get used to them, and then if you don't take them, you don't sleep. So what we then do is that we actually get used to this state of suboptimal sleep, and and like any addictions, we then need to increase doses. Those stop working, and then they have more side effects, which is a vicious cycle that we should be avoiding. Sleeping tablets can be given on rare occasion when the sleep deprivation is related to mental health in some way. But if it's not, if it's so, for example, if someone is experiencing something like a bipolar disorder or experiencing a severe depression or severe anxiety, then yes, we may think about sleeping tablets, but there's very strict guidance that we need to follow. So people shouldn't have sleeping tablets for more than 14 days at a stretch under any circumstances. But there are people who are taking sleeping tablets for years. All other medication we take has some effect or the other. So some make us feel sleepy, some make us feel alert. So it's always worth checking with your doctor whether this medication will affect your sleep or not. If it does, then don't have it close to sleep time, because it's a completely avoidable way. Many antidepressants are actually what we call activating, which means we should take them in the morning, make us feel a little bit awake. But there are antidepressants which we take at night, which make us feel sleepy, and then we should avoid them. So I talked about exercise. Exercise very important, throughout the day to make sure that we get rid of some excess energy, and then we can sleep. I want to spend a little bit of time about talking about our bedrooms now. It's important that we associate our bedrooms with sleep, right? With sleep, we shouldn't. So, for example, lying in bed with a laptop on your lap and a phone in your hand, and a trolley of food next to you is giving our brain the wrong message, right? So what happens is that we then our brain then associates that this is a workplace, this is a food place, and then all of a sudden we push all those aside and we say now fall asleep. And the brain doesn't do that; it can't switch off, and it stays in that activated mode, and it affects us. So we then end up having shallow sleep. I'm sure many of you here, remember the time when we would have one television in the house. So there used to be one screen for the entire family. Now there are multiple screens. So each family member has access to probably three different screens. There's a television somewhere in the house, there's a phone, there's a laptop, not to mention all the video game consoles. So multiple screens per person, iPads as well. So we are moving this entertainment, this again, like I said, our mobile suns, this light that we access ourselves all the time, we're taking them into our bedrooms, right? So there was a time when there was one TV in the whole household, and after a certain time, you didn't have that light, you didn't have that activation. But now it's happening. We're having this light with us. So making our bedroom for sleep alone. So at least the bed. The bedroom is pushing it. Some people say, well, I don't have the luxury, don't have that much space, which is fine. But if the bed, so if we need to read a book, we should sit on the desk, we should sit on a chair outside. If we aren't falling asleep, then we get out of bed. So keeping the bed for sleep. So that's really important, and it should be part of the routine as well that I talked about when we try and wind down. So about 4 hours before sleep, limiting access to phones. A lot of these phones nowadays have a night mode as well, so where they use lights which don't mimic daylight. They have a softer tone, the colors, the intensity of the screen, they're less. But it's best avoid if you do have sleep problems and you're not getting the right sleep. So avoiding screens about 2 hours before sleep time is crucial, particularly during this COVID time, because every time you open the screen, there'll be something, there'll be some bad news, there'll be more deaths, there'll be more infections, and that just makes us upset and it'll affect our sleep. So limiting our access to screens 2 hours before sleep time is probably one of the best things we can do. If you do have sleep problems, then turning your phone off and actually having it in a different room is also very, very important. So our brain is actually, even though we're sleeping, there's a part of the brain which still is alert. And we'll know this because, say, particularly mothers or parents, when they hear their child cry, even from the deepest sleep, they'll wake up. Very often, if you hear our name being called, we also wake up from sleep because our brain is primed for certain stimuli. Now, each of these devices of ours has at least 7 to 10 different unique sounds which our brains are primed to. So we have the ringtone, we have the buzzer, we have the alarm, we have the Facebook message, we have the WhatsApp message. And now there's a zillion other apps that are giving us notifications. And our brain's primed for all these. So we, even if the phone is turned off, even if it's on mute, our brain is waiting for those signals to come. But if we know that it's turned off and in a separate room, then the brain knows that, okay, you know what, those signals aren't there, so let's try and not wait for them. So we can go into a deeper level of sleep. Um, the environment in the room is really important. So having a comfortable bed, having a good pillow, having a good quilt. Uh, to fall asleep, if we can lower our body temperature by 2 degrees, that's what the science says. That if we lower our body temperature by 2 degrees, then it's easier to fall asleep. So having a shower, having just before we sleep, if we have access to air conditioning, or if we open the windows and have the fan on after having a shower, it lowers our body temperature just at 2 degrees, and it allows us to fall asleep. So that's really important. Having a warm drink, a non-caffeinated warm drink. So they often say a warm glass of milk if you're not a vegan. So having that, or having some kind of herbal tea, that really does also relax us. So part of that routine I was talking about, trying to get that routine into falling asleep, is so important. Right. So I see that I've got one more question here, a couple more questions. So there's one question: is sleepwalking? So it's a complex issue, sleepwalking, and it's related to our sleep cycles. So there's a particular part of the sleep cycle when there's paralysis, so we don't move at all. There's a particular part of the cycle where we do talk in our sleep, and in extreme cases, for some people, we walk and eat as well. So it's very difficult. And the only advice that we can give for that is that we need to try and maintain the sleep hygiene. So we need to focus on those 16 hours. What are we doing those 16 hours? How can we try and make sure that we have the good quality, have the available sleep time, and by focusing on health during those 16 hours? The next question is: I haven't taken any coffee from last 1 month, and nowadays having sleep problems. Even if I try so hard, couldn't sleep before it's sunrise, and I do not sleep all day. What should I do? So, it sounds like you're not sleeping much, which is quite, it's something that you need to think about quite seriously. Hopefully, if you rewatch the video, today's video, I've talked about many different things that you can try to fix that. If that doesn't work, then please get in touch, and we should be able to give you some advice about how it can be done. But if you're not getting much sleep at all, then you do really need to address that, but in a non-pharmaceutical way, so without taking medication. So please be in touch. Should screens be different for children and adults? So again, if we there was actually quite a big study done recently in the UK. So the Royal College of Pediatricians, they did a study on the effect of screens on children, and the reality is that the evidence that exists, right? There's a lot of social stigma, so we feel that no, screens are really bad for children, and the only evidence that they came up with is that screens close to sleep time are bad for children. So, yes, we do need to limit screen time for children before sleep time, because it will affect their sleep. They won't sleep. And as a result, they'll have all the health problems that we talked about. They may have. But during the daytime, having access to screens is important, because so much of their learning is going to happen over screens anyway through their lives. I mean, the adults nowadays, we spend 7-8 hours on a screen. If you think about laptops and phones and televisions, 7-8 hours is easy that we spend on a screen through the day. So a child, we need to make sure that they do limit that, because we need to make sure they get physical exercise, they do get one-to-one social contact. But having access to screens is also important, because so much of socialization, so much of learning happens on screens now. So denying them screens will actually handicap them for the life they have ahead of them. So I hope I answered all the questions. I think there aren't any more questions that I haven't addressed. So I'm going to wrap up the session today. First of all, thank you everybody who has joined the session and put up with me. Today's session was on sleep, the importance of sleep, the health benefits of it, particularly during this COVID crisis. If I want to summarize some tips, is that we need to have a routine. We need to give ourselves what we call available sleep time. So 8 to 12 available, 8 to 9 hours of available sleep time. We need to try and maintain that. We need to avoid caffeine after about 4 o'clock. We need to have exercise during the day, again, not too close to sleep time. Meal times, again, shouldn't be too close to sleep time and shouldn't be too heavy. And we need to try and develop a routine so that we have this process which allows us to slowly engage in sleep. So having indirect lighting, wearing comfortable sleep clothes, having a comfortable bed, having a lower temperature to the normal daytime temperature, and then avoiding activating activities in our bed, such as screens, and eating. So those are some tips to maintain good sleep. We need to avoid sleeping medication. There's now so much research on the negative effect of having sleeping tablets. So please speak to your physician and ask for those to be modified. So I hope you enjoyed today's session. I hope it was useful. I do plan to do this every week. The next session will be next Sunday at 7 o'clock Dhaka time. I haven't thought of a topic yet. So if there's anything that you want to hear, then please send us a message on our Facebook page, and I'll think about it. Our center, PHWC, is open for online consultation, for counseling, or for psychiatric evaluation if that's what you need. So please give us a call, send us a message, or send us just give us a call, and we will. Right, sorry, I can see a message about overthinking and enhancing positive thinking. So that's an interesting one. Thanks for that suggestion. I was thinking about ruminating as a topic, which will be very interesting. The previous video should be on the page. I will send the link to the person who requested it. Please follow our PHWC page so you can get notifications and like the page while you're still here. Thank you very much for your time, and please stay safe and stay home. All right, all the best.